The history of chlamydia. It was discovered unintentionally by 3 scientists that traveled to the island Java to research the pathogen that causes syphilis. The 3 scientists discovered chlamydia with the help of inoculated orangutans. Taking scrapings from people infected with trachoma, they then infected the eyes of orangutans with them to demonstrate the spread of the disease among individuals, later posing the question, how is the disease spread to newborns without contact? In 1960, it was confirmed a bacteria after the 1929 ammonia epidemic and was defined as a virus in 1935. Scientists then discovered it contains RNA and DNA. They concluded that it is actually a gram-negative bacteria without peptidoglycan. This discovery was crucial for further research. What is chlamydia? Chlamydia is a common sexually transmitted disease caused by the bacterium Chlamydia trachomatis. Although it's not the most dangerous STI, it is one of the most widespread infections, which can lead to more serious consequences. The symptoms can be immediate or go unnoticed, making the dangerous bacteria even more of a problem. It is the most common bacterial STI in Canada, more than 50,000 cases reported each year. What type of infection is chlamydia? Chlamydia is a bacterial infection. It is spread like any other STI. It is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected person. It can also be spread perinatally from an untreated mother to her baby during childbirth, resulting in conjunctivitis or pneumonia in some infants. What are the symptoms? Chlamydia has an asymptomatic nature in which it can be contracted for long periods of time without knowledge, further expressing the importance of getting tested. It is known as the silent disease. Symptoms include burning sensation during urination, abnormal smelly discharge from penis or vagina, bleeding between periods or heavy periods, abdominal pain, sometimes with nausea and low-grade fever, and lastly, swollen skin inside vagina, around anus, or testicles. Effects of chlamydia on reproductive system. For the female reproductive system, it can infect the cervix, which can lead to open sores and higher risk of acquiring HIV. It can also infect the urethra, which can follow with symptoms of urethritis. If it spreads to the oviducts and uterus, it can cause pelvic inflammatory disease, also known as PID. This consists of abdominal or pelvic pain and built-up scar tissue, which can cause infertility. For the male reproductive system, there is a chance to develop epididymitis, which results in unilateral testicular pain, tenderness, and swelling. Again, for the male system, this can also result in urethritis and prostatitis. As you can see, chlamydia is much more devastating to the female reproductive system. Effects of chlamydia on other body systems. It can cause eye redness, eyelid swelling, and eye discharge and crust. It can also cause redness of the throat and soreness. If left untreated, it can further cause mouth infections, tooth loss, gum disease, and dental pain. How can we prevent it? Preventative measures include abstinence, staying away from sexual contact, physical barriers like condoms, chemical barriers fail to stop STI spread, making sure your partner is uninfected, and a vaccine which is being developed currently, and also getting tested. How can we treat it? Chlamydia can be treated and cured with no permanent effects through antibiotics. The common antibiotics used in this treatment are doxycycline and azithromycin. However, if a woman is pregnant, there are substitutes available such as ethylsuccinate, erythromycin, and amoxicillin. Home remedies are also available to treat the symptoms of chlamydia, such as garlic, usnea, sage, saw palmetto, turmeric, cat's claw, and golden seal.